Tim, it's good to see you.
Hey, Trevor. Morning.
It is spring in Charlottesville, Virginia. There is nothing better. What's your top three Charlottesville spring?
I love getting out to get a meal outside. I'm a layer guy. I'm a sweater weather guy. I love the morning starting off that way. And then I like planning to go hiking, but it doesn't always happen. But just I like to view myself as an outdoorsy guy. So
Fantastic.
how about you? What are you up to? Are you just chasing kids around? Or
Well, if I was in Charlottesville, I'd be going to Foxwood horse races for sure. But maybe I've outgrown that.
I think you're too old for that, man.
All right, let's dive in.
Paul would usually say, let's drop the hammer or something, but I guess we can just be respectful about it.
We can't replace Paul. We can't.
Let's hop in, man.
Welcome to HealthTech Remedy, the show where three physician leaders in health technology tell the stories of new and established companies and interview leaders from the industry. I'm Trevor Royce, radiation oncologist and researcher with experience in real-world evidence, informatics, and AI diagnostics.
And I'm Tim Showalter, a radiation oncologist and prior medical device entrepreneur who is now focused on bringing AI advances to cancer patients. Missing in action today is our beloved co-host, the third side of our isosceles triangle of HealthTech Remedy, Paul Gerard. He started off as a physical medicine and rehabilitation specialist before focusing on reimbursement policy, molecular diagnostics, and market access for AI products. Despite being a great guy, he sometimes makes poor life choices for priorities and chose to hop on some conference call or something instead of joining us here today. So we'll have to do our best, Trevor, to keep the conversation going.
I think we can try. We can try. We can't replace Paul, but we're going to try today.
Yeah, we'll do our best. We won't talk about watches or craft beer from Maine today. So listeners should dial in for another episode in the future if they really want that.
We should have a standalone craft beer episode where Paul can really just shine.
And we could just hang out and enjoy the beer. All right, kick us off. What are we talking about today?
All right. Today, we've got a good one. I'm personally excited about this. This is a topic kind of near and dear to my heart, Turquoise Health. They are a health technology company that has built a platform to provide price transparency to healthcare. So they're a neutral third party in the healthcare ecosystem, and they've positioned themselves as a meeting place for transparent relationships in pricing. And then later, we're going to speak to Carol Skenes, VP of Product at Turquoise Health. We can talk a little bit on this issue of price transparency, but maybe before we dive into that, Tim, tell us a little bit about Turquoise and how they came to be.
I think a lot of what they were focused on for the sort of the genesis is if you've experienced the lack of price transparency as a patient or as a family member, you know how confusing it is. So understanding that the cost of your MRI, for your mid-40s weekend warrior knee injury can vary wildly from hospital to hospital and from practice environment to practice environment. Is it hospital-based or is it freestanding clinic? And, you and I both know this, that when I've had patients ask me how much will this course of radiation cost me? And it's weird. It's we don't know, and you can get an analysis or a prediction, but sometimes it's off of comparing ultimately the patient's out of pocket, what their insurance company paid, using a sample patient previously treated. It's not like there's a menu of prices. And I think overall, Turquoise came on board where the policy pressure really mounted over time. And we could talk a little bit about what the legislation was. I think there's a few ones to cover, but I think the general sense is this is a problem that needed to be solved, and the time was now to solve it. And you and I think we have a great colleague from Flatiron when we were there, Forrest, who joined there, and he's a smart guy and is driven by mission, and you always know he'll be up to something good. So that honestly, that's how I first heard about Turquoise, and what I've learned since then has been really impressive. I mean, they've really established themselves as a thought leader. They've published, academic and sort of policy informing research, and it's pretty impressive. And they've got their own sort of learning university online for folks who want to learn more about these topics. And so they've really established themselves as sort of the epicenter of this conversation.
Very cool. Yeah, I actually was not aware that they had a educational component on their website, so I'll have to check that out.
Yeah, it's called TQU. I think TQ is for Turquoise. We can also ask Carol that too.
Yeah, I think the education component is so important in this because, we know experiencing it day to day as providers, the relationship between who is delivering a service or recommending a service, the provider or caregiver, is so far from the recipient or the patient in terms of the costs and the costs involved and how, funds are being transferred and all that, because you have the payer in the middle. And so, not only do we not know how much things cost, but the recipient or the patient also doesn't know how much they cost. And in fact, you could even argue, not to be nihilistic, but do we even care what the cost is? And the system is in part set up to not care because you have a payer that's thinking about that and taking care of those costs. And at any rate, the system is set up the way it is, but a consequence of that is that no one really has any idea how much things cost or who's getting paid for what. And the entire process has been totally opaque. And so there's been some legislation that was introduced that basically was forcing healthcare systems to post prices, and the prices are different from the costs. A contract with a payer for a service can be different from what a hospital says that they list that service costs. And so part of what Turquoise is doing, or at least my understanding, is being an aggregator for that data that now is publicly available, putting it all in one space so everyone can see how much things cost. And it'll be awesome to hear from Carol kind of what they've been able to accomplish to date, but also what some of the challenges are in getting that pricing data.
Obviously, this is an age-old problem. As a couple like healthcare natives, there's an element where with the U.S. healthcare system, it's a little embarrassing. It's taken this long to have a turquoise health. But maybe you want to just share with our listeners what their founding timeline and story is.
Yeah, so their timing coincided with a lot of this transparency legislation. So they were co-founded in 2020 by Chris Severn, who is the CEO, and Adam Geitke, who is the chief technical officer. They had a Series A for 20 million in 2022, led by Andreessen Horowitz, with participation from Bessemer Venture Partners, Box Group, and Tiger Global. So some sort of big name venture backers here. And then in January of 2024, last year, they had a Series B. They raised 30 million, led by Adams Street Partners, with participation from Yosemite and some existing investors. And basically, the goal of that Series B was to support these further transparency pricing efforts across a customer base, I think, of over 160 healthcare organizations. And with that, in April of 2024, they acquired Bramble Health, which was basically a management platform to empower primary care providers and regional health plans to basically understand their networks and unlock those networks and become a more transparent marketplace. The founder of Bramble was Molly Moore, who also joined the Turquoise Health team. And we'll hear more about this from Carol.
It's interesting for this story because this is like a deep technical team. Like the founders are very strong technically, but they also had prior experience within healthcare, like revenue cycle management and an understanding of the payer landscape. So I think, my sense is they had, sort of earned their stripes, so to speak, within healthcare, and yet have like really strong technical background. And honestly, it's probably a really challenging technical problem. And I don't really have my head wrapped around how they pull all the data together. The way the legislation went down, like there is some expectation that the data provided by hospitals can be ingested in a sort of technology stack and a machine-readable format.
A critical one to be aware of is this hospital price transparency rule, which really came into play effectively January 1st of 2021. So right around when Turquoise Health was coming on scene, I think that's not accidental. And basically, this was a really keystone moment in price transparency for healthcare, where CMS, the largest payer in the US, was requiring hospitals to publish some of their charges. And so this required, to your point, a machine-readable file, so some sort of ingestible format containing gross charges, discounted cash prices, payer-specific negotiated charges, de-identified minimum and maximum negotiated charges. And they had listed 300 sort of shoppable services that a hospital must provide and post on their website with some kind of consumer-friendly display with a description of the services and the prices for each service, and so forth. So just to give an example, you could want to know how much a CT scan of your chest costs, and you could actually go on the hospital website for the first time, as mandated by CMS. If you, and there, we could talk a little bit more about what kind of penalties that may exist if you didn't post this. But basically, the spirit of it was to have hospitals post these prices, and then presumably patients could look around or providers could look around and basically compare, introduce a more competitive market in a very non-competitive healthcare environment to try to bring some of these prices down. As we know, the prices in healthcare across the U.S. have just exploded over the last 20 years to the point where it's a major part of the GDP goes towards healthcare.
Yeah, my sense is that like this is, it sounds obvious, like if you go to, Ben and Jerry's, and you want to get ice cream, what the prices are. My sense is the hospitals really are generally not set up for this. So, my understanding from reading what I could about Turquoise is that part of their pitch, for hospitals and providers is to is to actually help them get that information on the website and help them understand what a price should be, get a sense of the competitive landscape and to help them put it into machine readable files. But my understanding as a consumer and provider who's like sort of clicked around some of these websites is that people haven't done that well with this. So I think we definitely need an entity like Turquoise to help push this along.
Yeah. It might be useful spending just a couple moments to speak in specifics what this actually looks like. And just to illustrate that, as a researcher, when I was full-time academics doing health services type research and health policy research, there was a lot of excitement when this price transparency rule went into effect and all these prices were suddenly going to be available online. And so what we did was look at how much a course of radiation for prostate cancer would cost amongst a bunch of different cancer centers that were now required to post these prices. And it was very quickly obvious, number one, how big of a mess it is implementing this, like in terms of adherence. Something like 80% or maybe even less than that of the hospitals actually were complying and listing their prices. And then the prices listed were so widely variable. I mean, for a course of radiation, we saw charges for, say, a 28-course treatment of prostate radiation from $20,000 to $400,000. So it's really hard, you can imagine as a patient with prostate cancer, how to make heads or tails of this. If you could even find where the prices are listed on websites, and why there's such wild discrepancies between the costs.
Which connects with the next thing, because basically you can't surprise patients.
Right. To your point, there have been some subsequent legislations like the No Surprises Act, which protects patients basically from unexpected out-of-network bills. And a lot of this relates to emergency room visits or anesthesiologists or radiologists, where you may be seen at a hospital, but some of those providers may belong to a different network and could charge differently. There are all sorts of weird consequences of that, where you could get these massive bills for seemingly routine care at hospitals.
It's terrifying. It's like the last thing you should have to think about.
Yeah. And then there was the transparency and coverage rule. I'm less familiar with this one, but that was started in 2022. Basically, subsequent iterations of this, of these transparency efforts. One challenge with these transparency efforts has been adherence from the hospital side. And so there have been all sorts of penalties that have been introduced over the years of sort of increasing severity, cash penalties against hospitals that are not posting their prices transparently.
Yeah, and my understanding of the transparency and coverage rule, and I'm no expert, this is where we miss Paul, but my understanding is that it's sort of like this pulls the group health plans and the health insurers into it. So, it's the idea is that it would help the beneficiaries to understand, given a set of services, what can they expect to pay? And it should potentially work with both negotiated rates with in-network providers as well as, what's happened in the past with out-of-network providers. And there's some responsibility to make sure it's available by an internet browser. We can talk a little bit about the Turquoise platform. They've got a lot of solutions for each of the stakeholders. So I just briefly sort of menu them off a little bit, and maybe we can go deep on a few of these with Carol. So one is that they have a solution for clear rates data. I think this is just directly solve the need to post data on each hospital's site about prices for services, analytics to help the payers and hospitals have benchmarks for what the rates are generally in the market and what makes sense. They have a solution to have clear contract information. And so this helps payers and hospitals to have all of their agreements, because they may have hundreds of agreements for different services or with different payers. And so the idea is that to leverage AI and technology solutions to reduce the administrative burden so they can actually access their own information. There's a search functions, which helps patients who are members of our participating health plans to search care and find pricing for services. So for example, if you're going to get a colonoscopy, you can enter your insurance plan information and find providers nearby and get a sense of your cost. This checks a lot of compliance boxes overall for the hospitals. So I think Turquoise helps hospitals get their machine-readable files in order and get access to information to plan their business objectives. They can enable good faith estimates provided directly to patients. And then I think they can set their custom rates for various services using benchmark data. And then the other thing that I think is really helpful, getting back to the alternative payment model, is a potential for what they call standard service packages. So all this information can be used to create a single bundled package. And I think this is important for hospitals to offer these sort of marketplace type services. And it's really important for, if you're a patient or even I would imagine a payer, to understand what's all in for that service. So I think that's a really like key tool. They can pull in several billing codes and create like one package service.
Amazing. Yeah, so they've really inserted themselves in the middle of this transparency conversation with some really unique products available, and I am personally very excited to hear from Carol about kind of how they where they see this transparency effort going, and how they can have a business around it, and also advance sort of value based care in the U.S. through it.
Things I want to sort of touch on is I really don't understand exactly how they make money. So I'd like to understand that. Like, what are their big customers? I certainly know how they make an impact. I think there's something there. And I'm also curious with the new administration if there are significant changes that they're watching out for. So it'd be interesting to touch on that with her as well. Trevor, before we meet with Carol, I'll just also mention to you that she is a graduate of Georgia Tech. So there's some ACC connections, and then the other thing is she does have deep experience in price transparency work. So it'll be interesting to get her perspective on sort of what Turquoise has done and where they're heading.
Fantastic. Looking forward to chatting with Carol soon.
Carol, welcome to the show.
Hi, good morning. Thanks for having me.
Where do we find you today for this interview?
You find me in sunny Charleston, South Carolina.
We are all envious of that. Trevor and I are in Virginia and North Carolina, respectively. But I think you win right now.
As long as it's not a hurricane, then all we have to complain about is pollen otherwise.
Right. Minor detail. Yeah. Well, we were excited to learn more about Turquoise Health, but before we hop into that, we were hoping to learn a little bit more about your own career journey and maybe starting with your educational background and then how you came to focus in healthcare and then more specifically Turquoise Health.
I went to undergrad at Georgia Tech and was on an operations specific track. And there was one elective that I took my junior year called Management of Healthcare Operations. And I live for the day that someone asks me, where were you when you first learned what a DRG was? No one has asked me yet, but it would be in that class. And it was the first time that I'd ever considered there was a whole business administrative side to healthcare. It was at the time kind of understood that you could either be a clinician or you'd go on and do other things. And I really enjoyed thinking about business. I enjoyed thinking about these massive problems that were going to take a bunch of smart people to solve in healthcare. And I was coming off of a summer internship where I worked at an oral surgeon's office in my hometown, just, doing little things here and there, learning about billing, kind of learning about the process of keeping the lights on at a clinician's office. And it really stuck with me from there. And so that class and that experience had me choosing to start my career once I graduated in healthcare consulting. I spent a good chunk of time working in revenue cycle consulting, understanding managed care contracts, the relationships between healthcare providers and insurers. And then eventually I pivoted into the startup world, first doing revenue cycle automation, and now where I am at Turquoise, focused on price transparency.
Well, kudos to you for figuring out what a DRG is so early. I will say that Trevor and I are both physicians, and you probably have a higher level of understanding about it than I do even now after practicing for so many years. I was going to make a prostate cancer joke about where I was when I first figured out what a DRE was, but then I figured that would be too classless. So I'm glad that we avoided that. So.
No, someone in our listening audience is laughing right now, I promise.
Yeah, I think you're in a rare subset on this call that can tell the difference between a DRG and a DRE. So we're doing all right today.
Yeah, exactly. Well, I guess, I think it's a really helpful background and it does explain a lot about transitioning from a really strong technical background into the healthcare reimbursement space. And we certainly need people like you who've deep experience and deep understanding of the landscape, even more than the average physician taking on these problems. And I'd be curious to hear sort of in your words, how would you describe Turquoise Health's business? If you're talking to a layperson or, a stupid radiation oncologist like me, how would you describe the business line?
When I first joined Turquoise and people asked what I did, I just said that I worked at a startup. And then if they took it one step further, they asked specifically, what did I do at the startup? Honestly, I just said data modeling. That had nothing to do with what I did, but it just felt like the easiest answer, sort of what a stereotypical startup employee would do. I have since graduated from just saying that I work in data modeling, and now particularly that there's more awareness of this concept of price transparency. Usually what I tell them is that we're working to make prices more transparent for patients as consumers and also for stakeholders in the industry. And honestly, that's usually about as far as I get into me doing the talking, because as soon as you mention something related to price transparency, usually whoever it is you're talking to either has a question about a bill they've received recently. Well, you work in price transparency. Do you know anything about XYZ authorization or denial? Or they share a story about a bill they've received or someone in their family has received that they were not expecting, is higher than they anticipated. So it ends up being a conversation that hits close to home for a lot of people. They internalize what we do based on their own experiences interacting with this healthcare system.
I bet. I think we've all got our stories about trying to figure out what something costs or trying to tell a patient what something costs, and it's
Right.
really challenging.
Agreed. I know. I think it's one of those things where if you were to ask any person, what do you think needs to improve on the administrative side or the business side of healthcare? It's one of those moments where it's like, well, how much time do you have? Let's go get a coffee. Let me tell you about all of these things that I've experienced or people around me have experienced. So it is very personal in that way, but it is also a massive macro problem that we're trying to solve.
And can you reflect a little bit on kind of how far we've come on price transparency and, how far we have to go still? And related to that, kind of how Turquoise is getting these data, how things are integrated. How do you interact or integrate with providers, hospitals, payers? Like, describe to us how Turquoise sits in the middle of all this and how that's possible.
So, for those who don't know as much about the price transparency legislation, in terms of how far we've come, it was on January 1st of 2021 that we first got access to what is known in the industry as machine-readable files, or MRFs. And contained in those MRFs that first came specifically from hospitals were a number of data points related to gross charges and self-pay cash prices, but also specifically payer negotiated rates that were the negotiated rate, let's say, between an Aetna or a Cigna or a Blue Cross, between that insurance company and the specific hospital. And those negotiated rates prior to 2021 were guarded under lock and key. There were very few people who knew what the rates were. It was sort of viewed as a competitive or a negotiating tactic to keep your rates to yourself if you worked for a hospital. But as we know, if you have insurance or percent coinsurance or the ability to hit your deductible, your out-of-pocket max, a lot of that is predicated on understanding what that negotiated rate is. So in terms of how far we've come, when the machine-readable files first came out from hospitals in 2021, and then in July of 2022, payers were also required to publish their own rates. The glut of information that became available over that 18-month period of time ushered us into this new industry pretty quickly, right? Of previously, we were in an industry that didn't know these rates. Now, not only does the industry know them, they are free and publicly available to go download. Now, there's some size constraints, and a number of people have said they have tried to download a payer machine-readable file. It promptly crashed their computer. But they're not behind paywalls, that they are available for public consumption, for innovators to parse them, look for trends, and so on. So when I think specifically about the concept of price transparency, in my mind, there's this pre-MRF world, and now we're in this post-MRF world. So what we do is aggregate data from a couple of different sources, those hospital machine-readable files, the payer machine-readable files. We also pull claims data, some Medicare reference data that is publicly available. And the reason we pull each of these different data sources and aggregate them together into one, platform experience is because I think each of the data points gets more compelling when it is looked at alongside each of these other reference points, because now all of a sudden there's this world of benchmarking. There's the ability to compare results, commercial rates to Medicare rates, looking at different types of hospitals nationally, looking at different hospitals within a state or a specific CBSA. So in addition to just that integration process, we are taking the data in the machine-readable files and parsing it essentially to remove a lot of the noise. If you've read anything about MRF data or spent any time learning about price transparency, you've probably seen some reports that there are duplicative rates. There's a lot of outliers, a lot of one penny reporting. There are clinically implausible rates where it might report that someone like a psychiatrist is performing a double lung transplant. Pretty sure that's likely not happening. So those sorts of rates, which take away from the real, I would say, noteworthy rates that lead to that benchmarking comparison, we extract those, and then when others are using the data, they're able to get to the specific subset that is most meaningful to them.
You've aggregated these data, you've cleaned them up, now they're usable. And so, what's the next step for people to use these?
Yeah, it's a great question, and it depends on who the stakeholder is, kind of how they're asking that question. So, if you are a hospital or an insurance company, and let's say you have an annual negotiation coming up, or every 3 years you're negotiating, your first question is, how do these rates compare in the market? So, let's say you have a burn unit. How do these rates compare to other burn units nationwide? Or how do these rates compare to the hospital down the street, the hospital 2 hours away? They want to know these things because they're usually particular areas of shoppable services or areas where a hospital has invested a high amount of clinical expenses or research, areas where they are truly excellent in some of their service offerings. And they want to make sure essentially that those are the areas that they're focused most on in these negotiations. So it evens the playing field in terms of how providers and payers negotiate these in-network rates with each other because the rates are all now publicly available. And then from an employer perspective, if you are self-funded or you are working with a broker to make sure your employees are, going to what you want, right, is high quality care, not at low cost, right, but at a cost effective level. So you don't want them to have to go somewhere where they would have to get the same surgery twice, maybe because the quality wasn't as high. But if you're paying top dollar for something, you want to make sure that the quality is equally as impressive. And so they will use the data to say, okay, well, how do our rates compare based on these negotiated rates? And what can we then marry the rate data with quality data to better understand that our employees are getting the best care in whatever geographic location they're located? And then last but not least, ultimately, a lot of this is for patients as consumers, right? To come full circle to your question about where is this going? I think that is the North Star is can we as patients as consumers and as people who are scheduling care for our family members, can we know before a visit occurs what our cost of care will be? Can we make decisions accordingly, price shop, or decide it's worth it to pay more because I trust this physician? And then after the service, can we have a high level of confidence that we're not going to get a second or third or fourth bill that's different from the amount that was quoted to us up front?
Amazing. I mean, what an amazing catalyst you guys are playing to make this whole conversation actually happen and drive prices in a very rational way. I think that's just very noble work what you guys are doing. Are we at the point yet where this is patient facing? Any of these data? And
Yeah, so the No Surprises Act, which is one of the rules and laws that Turquoise really has built as foundational to the products that we're working on, has two different requirements. One for patients who are either going to be cash pay or they're uninsured, a good faith estimate, and then one for patients that have insurance called an advanced explanation of benefits. Both of those are required within the No Surprises Act. Neither of them have enforcement dates yet. But for technically savvy users who, can look at just a very focused cut of these machine-readable files, if they understand their cost-sharing element, then it's a high barrier to entry, but that's exactly where we're getting. And so we're at this inflection point of, by nature, a machine-readable file is not a human-readable file. So it's on us and it's on the industry to take the information from these MRFs and translate it into say, okay, Tim needs a knee replacement. He's going to this hospital. He has this insurance. What does the in-network rate show in that machine-readable file? And what does that mean for Tim? Tim has a 10% coinsurance. He's going to pay X number of dollars. That's what that looks like, I would say, in a clean patient experience.
That's really interesting. It seems like you guys intersect with all the stakeholders, and I can see how you really do need an entity. And frankly, it's shocking that it took this long to get a Turquoise Health out that it's doing this. But I'm curious, in the on the business side, how what's the general are there subscription fees or what's the general way that a company like Turquoise makes money?
That's right. Subscription fees in terms of the data is publicly available. It is massive. Our co-founder, Adam, has written about the process we go through to parse a petabyte of data a month. So the sheer processing power, right, and storage capacity needed for that is one element. But like we talked about earlier, one negotiated rate in a vacuum is not nearly as impactful as negotiated rates alongside other they're publicly available data sets or kind of general executive views when it comes to benchmarking, looking at things in an aggregate, being able to get the information that you need from the data without having to physically query the data yourself. That comes in the form of subscription to the data. And then we also have access to a product called Clear Contracts, where the actual documents where those in-network negotiated rates live, whether they're PDFs, CSVs, Excel files full of fee schedules, sometimes documents that are printed and handwritten, with rates in the margins and scanned back into something like a SharePoint. We store all of that as well. And can use AI to extract the relevant data.
Okay. Yeah, I can imagine like you're saving these administrators a lot of time.
That's right. And if you have a large analytics team and you want query access to the data, that's available as well. It kind of depends on if you want that no code experience of I have 5 minutes, tell me the facts, or if I have 2 hours and I want to really dig into the queries and get down to the granular level.
You've got this long history within price transparency and have made a lot of impact at Turquoise. Curiously, what are you most proud of that you guys have put together? What do you think is the most impact?
I think a couple of different things come to mind. The first of which is that we are hearing instances where a patient as a consumer is able to price shop or get a more favorable rate, or in general, just feel more educated on the questions to ask and the type of experiences they can have around scheduling their care. So that in particular, this is who we're doing it all for, right? These are the people who benefit. But I would also say from a legislative perspective, there is the hospital final rule, the transparency and coverage final rule, and the No Surprises Act that have all grown and matured over the last few years. And Turquoise has really become students to those rules and laws because they are, like I said, foundational to the work that we do. And because of that, we've done a lot of responding to requests for public comments and, done a lot of writing about how the legislation can be improved. And a lot of that is culminated in getting footnotes in specific final rules. And then ultimately our CEO, Chris Severn, was able to go to Washington and testify before Congress. So hearing the work pay off in terms of the people who are listening, who are foundational to moving this forward up in Washington is a proud moment for us.
That's amazing. I mean, I think it is so amazing that you guys can help push and support these legislation and actually show the impact, like the direct impact to the patients for these types of legislations. Curious, to hear you reflect a little bit in kind of a nonpartisan way, but just on the reality of sort of the supercharged environment in the U.S. on the political side and how a company like yours may be impacted by the winds of an administration, because so much of this was enabled by this very forward-thinking transparency rules and regulations. And just kind of curious your reaction on that.
We are fortunate that price transparency has gone through now multiple administrations, Republican and Democrat, and the iterations have continued up through in February of this year, I believe February 25th, President Trump signed an executive order that was bolstering price transparency efforts. And so we do see this as a rare moment of where the previous President Biden also, there were updates to the hospital final rule during that administration. And so we are seeing incremental progress from both parties. So we view it as our responsibility of making sure that, to exactly your point, what we are stating is what is best for the future of price transparency when it means getting real prices in front of patients. Then from that perspective, we're able to look at it not as a political hot topic, right? But as we can view what Turquoise is doing as a resource to empower some of these legislators to help both the stakeholders who are required to build these estimates and these machine-readable files be successful, but also help patients understand how they can get access to the information that they need.
Yeah, amazing. I mean, I think hopefully we can all agree, within this call and without, that price transparency, efficient marketplaces, lower prices, lower costs for patients is a bipartisan effort. So I
Right?
hear you. Yeah.
Yeah.
Carol, we always try to get a little bit of advice for listeners who may be earlier in their career, who want to make an impact within, an important issue like price transparency. And I'm just curious to get your thoughts on going back to Georgia Tech student Carol or someone at a similar life stage, what advice would you have for someone who wants to, enter this space and make a real impact?
It really is the idea of being a student of the industry that you want to get into. There are a lot of very smart people who are solving very challenging problems, and it is helpful to kind of know the background of those. So, a lot of these resources are publicly available. Read up on the things that interest you, ask questions, and I would say trust your instincts on areas where you think you might like to focus, but also strong convictions loosely held. You may learn some things in the process as to either why the current system is the way that it is or what efforts have been made to improve it previously. But if you view yourself as a student of the work you're doing, then I think it makes you a more successful, intellectually curious employee.
Thank you so much. Thank you to Carol Skenes, Vice President of Product for Turquoise Health. It's been a pleasure having you in HealthTech Remedy.
Thanks for having me. I appreciate it. Good time.
Thanks, Carol.